Good afternoon. I'm Julie Gibbs, the Administrative Director for Riley County Health Department and also the local health officer. I'm here to give you your daily update in response to COVID-19. As of today, we have had 98 positive cases in Kansas, with 2 deaths in the Kansas City area and 1 positive here in Manhattan. Of that 98, 41 were female, 57 male, and the age range is 7 to 90 years, with the median age of 52. There are a total of 2,086 negative cases in Kansas. We learned yesterday that our Manhattan resident who was tested positive is actually a Pottawatomie County resident and not Riley County resident. That does not change our disease investigation process. That has been done, and we are still in contact with the patient and his family. The patient is being treated at Via Christi Hospital, and his family is being isolated at home. We are also in contact daily with the students he traveled with. They are being quarantined and monitored for symptoms. In coordination with Konza Prairie Health Center, we did initiate a drive-through swabbing station today. This is taking place at the Family and Child Resource Center across from the health department. This is only for individuals who have symptoms and have been evaluated by their provider. We cannot allow for individuals to drive through without those measures in place. The first step is to call our screening call center. If you have symptoms such as fever, cough, or shortness of breath, please call 785-323-6400. This is managed by healthcare professionals and will be available every day from 8 a.m. until 10 p.m. Again, this is only if you're experiencing symptoms. From there, depending on your condition, you may be directed to call your primary care provider for further evaluation. At that point, they may direct you to the swabbing station. Again, please call the screening center first at 785-323-6400. As of last week, we have activated our EOC, or Emergency Operations Center. This provides a center for decision makers and response team personnel to gather critical information, coordinate response activities, and manage personnel as the emergency situation dictates. Our overall goal is to prevent spread and help reduce risk. It will take being proactive to do so. I need your help with this. Please stay inside unless absolutely necessary and spread the word to your friends and family. It takes the whole community to make it happen. We have to act as one. The current order put in place is there to protect you, and the overall message is to stay home. By doing this, we can help flatten the curve and prevent the healthcare system from being overwhelmed. If you have questions specific to the current order in place, we will set up a Q&A hotline. This will be answered by Riley County Health Department staff from Monday through Friday, 8 to 5. This is an attempt to clarify the order and what businesses are exempt and what guidelines they should follow. Now I'd like to introduce Kurt Moldrup, Assistant Director at the Riley County Police Department.
Hi. As a member of the Unified Command at the Emergency Operations Center, I was asked to come and talk about the order that Julie has issued. Simply put, it's working. We're seeing very little movement in the community. Officers are reporting that they're not seeing a lot of people out, apparently unnecessarily, and I think that's important to let the public know that this appears to be working. As you know, there's currently not a stay-at-home order, and we really don't want to have to put one out. So we're asking the community to continue to do their part by staying at home, going out only for essential needs. By doing that, we will reduce the potential for having a stay-at-home order. With community spread, that's one of the triggers for us to issue a stay-at-home order. And so by reducing the amount of community involvement you have, we reduce the risk of having to have that stay-at-home order. We ask you to continue to minimize your public contact, continue to practice that social distancing that everyone's hearing about, and listen to the guidance that you're being given by the officials. Next, we're also doing everything we can to keep the public informed. We're putting together some information packets for the businesses that are open, which a lot of businesses are open, to help them understand how they can continue to meet to comply with the order and still maintain their business. We're also making cards for officers to hand out to the public to help people know what the information line is, what the screening line is, as well as some contact points to get good information on the current situation. So we want to end by saying thank you to the community and to the local businesses for the voluntary compliance that we're seeing. We appreciate it. And if we continue to do this, we won't have to move to the next phase. We have some time, I believe, so if there are any questions, we'll stand for questions, both Julie and I.
The first question is actually for Julie. When you talked about the number of negative cases in Kansas, will you give us an explanation of what that means?
So those are the number of specimens that we did send in that have been sent in throughout the state of Kansas that were actually negative. So we've had the 98 positives so far, and overall over 2,000 negative.
Excellent. Let's see, just scrolling through here. Will you give us some information about when that hotline is going to be available for questions and answers? And please repeat the question.
Sure. The question was, when will the hotline be available, the Q&A hotline? We're hoping to have it up as soon as possible. We do have the number for it, and we're working on staffing right now. So hopefully within the next day or two, we will have that up and running. As of now, you can continue to direct your questions to the health department, 785-776-4779. We're also available on the Facebook page. Just have some patience with us. We do have a high volume of questions right now, so please have some patience. And if we don't get back to you for some reason, you can always call in or message us again.
And I would add to that, we're asking the public to do the best they can to not call 911 or the Riley County dispatch line, to call the health department or when we get the information line up, so we don't increase the call load at the police department.
This one is also for Julie. You talked about the swab station and people needing to call being directed to call their primary care doctor. If someone doesn't have a primary care doctor, what do they do? And please repeat the question.
Sure. So the question was, if they don't have a primary care provider, what would they do if they're experiencing symptoms? So we still want you to call the screening line, 785-323-6400, and they will direct you in the right direction if you don't have a primary care provider. Depending on the answers to your questions, it could be that they might send you to KSTAT or Kanza.
Okay. And this question is for Director Moldrup, Assistant Director Moldrup. Are we still okay to go out for walks, assuming they maintain social distancing?
Yes, the question was, are we able to still go out for walks and still maintain social distancing? And that's really the point of what we're trying to say, is we don't want to do a stay-at-home order that really starts to restrict that kind of movement. So yes, you can go out for walks. I think that's good for the mental health as well as the physical health of everyone. But as we said, we really want to reduce the amount of public contact. We're not going to contract this virus just from the air from walking around. It's going to be, we want to keep that social distancing. So yes, you can go out and exercise, but maintain the intent of the order and social distancing.
This next question is for Julie again. The question itself is, how many people have been advised to self-quarantine?
I cannot tell you. The question was, how many people have been advised to self-quarantine? And while I do not have a number for you right now, I can tell you that we take that very seriously. We do send out guidance for that. We actually make contact with the individuals who need to be self-quarantined, and we give them the guidance on that, check back with them daily to monitor their symptoms. So while I don't have a number right now, we can always get that for you later.
Also for Julie, there's some new guidelines from KDHE about testing and who gets tested. Can you help explain those?
Sure. So we're currently looking at those The question was, there are new guidelines from KDHE about testing and who exactly gets tested. Yes, those guidelines came out, and we have forwarded those on to our providers. The hospital, we believe, is following those guidelines as of right now, and we are currently in communication with our healthcare providers for those testing guidelines. So.
Okay. Do either of you have any one more for Assistant Director Moldrup. Can you give some guidance about how long the current order might be in place?
The question was how long, do we have guidance on how long the current order will be in place? Great question. That really depends on two factors, I'd say. Community support by us continuing to do what we're doing. As I said, what would cause us to go to a stay-at-home order would be community spread. So if we reduce the chances for that community spread by maintaining social distancing, by being out in the public and with other people, again, remember this order is an order to stay away from groups of more than 10 and still maintain that social distancing. So as we continue to comply with that, we reduce the need for a stay-at-home order. And how long this order stays in place other than that will be how long we continue to have this battle with the virus. So we can reduce it by staying home as much as possible.
Also, can you talk about grocery stores and pharmacies? Even if we progress to the next level, will this affect those places?
Great question. The question is, if we move to a stay-at-home, will it affect grocery stores, pharmacies? And the answer to that is no. In fact, there'll be a lot of exceptions, which is, again, one of the reasons we really don't want to go to that. But grocery stores, pharmacies, there'll be a lot of businesses that we will consider critical infrastructure that will stay at home. Understand the goal of the health department, of the command structure, is to not shut things down, is to try and get things as normal as possible, but continue to balance that with protecting the public. So those critical stores will be open.
Excellent. We'll take one more question. Julie, can you provide specifics about the KDHE guidelines at this point, guidelines for testing?
Not at this point, but we can get back to you later with those answers. Sorry, I forgot to repeat the question. The question was, can I provide specifics on the KDHE guidelines? And while I'm not going to right now, I can at a later date.
Excellent. Thank you so much for your time.
You're welcome. Thank you.
Thank you.